Today we are discussing about pterygopalatine fossa. So the pterygopalatine fossa, it is a pyramidal shaped fossa situated below the apex of the orbit. So it is a pyramidal shaped fossa situated below the apex of the orbit. Okay, so the pterygopalatine fossa, the apex is directed downwards. So it is a pyramidal shaped fossa. So it is a pyramidal shaped fossa. Okay, so this is the pterygopalatine fossa here. Okay, it is situated below the apex of the orbit. So this is the orbit. So the apex of the orbit, it is like this, right? The apex of the orbit is directed backwards and somewhat little downwards. So it is a pyramidal shaped fossa situated below the apex of the orbit. Okay, so coming to the boundaries of the pterygopalatine fossa. So in front we have upper part of the posterior surface of the body of the maxilla. So this is the maxilla, right? So this is the posterior surface of the maxilla. So it is bounded anteriorly by the upper part of the posterior surface of the body of the maxilla, and behind we have root of pterygoid process. Behind we have root of pterygoid process. So behind we have root of pterygoid process here, and anteriorly by the upper part of the posterior surface of the body of the maxilla. So this is the body of the maxilla. Okay, so this is the body of the maxilla, upper part of the posterior surface of the body of the maxilla. And coming to the apex, it is formed where the anterior and posterior walls are formed. Apex is formed by where the anterior and posterior walls meet, and sometimes the pyramidal process of palatine bone also forms apex. So the apex is usually found by the meeting point of anterior and posterior walls, and also sometimes it is also found by the pyramidal process of the palatine bone. And coming to the above relation, coming to the superior relation, it is formed by the superior relation, it is formed by the orbit. It is formed by the infraorbital fissure. It is formed by the infraorbital fissure, and also it is formed by the orbital process of palatine bone and the body of the sphenoid. It is formed by the orbital process of the palatine bone and the body of the sphenoid. And these are the boundaries of the pterygopalatine fossa. Anteriorly it is bounded by the posterior surface of the body of maxilla, and behind we have root of pterygoid process and the adjoining part of greater wing of sphenoid. The adjoining part of greater wing of sphenoid and the root of pterygoid process and the adjoining part of greater wing of sphenoid. And here the apex is facing downwards, and it is formed by the apex is formed by the way the anterior and posterior walls are meet, and it is also formed by the pyramidal process of the palatine bone, and base is directed upwards. It is formed by the infraorbital fissure. It is formed by the infraorbital fissure, and also it is formed medial to that infraorbital fissure, medial to that communication. So base it is directed upwards. Okay, base it is directed upwards, and it is related to the inferior orbital fissure. Medially to the inferior orbital fissure we have orbital process of palatine bone and the greater wing of sphenoid. So these are the boundaries, and the medially and the pterygopalatine fossa medially it is related to perpendicular plate of palatine bone. So the area which have mentioned with striped lines, this is the perpendicular plate of palatine bone. So the pterygopalatine fossa, it is medially related to perpendicular plate of palatine bone, and laterally it is related to the infratemporal fossa. Laterally it is related to the infratemporal fossa through pterygomaxillary fissure. Okay, so these are the boundaries of the pterygopalatine fossa. Usually the pterygopalatine fossa consists of 5 openings and 2 fissures. Pterygopalatine fossa consists of 5 openings and 2 fissures. What are the 2 fissures? Means they are the 2 fissures. They are pterygomaxillary fissure. They are the pterygomaxillary fissure and infraorbital fissure. These are the fissures. These are the 2 fissures that are in contact with the pterygopalatine fossa. We know that to the pterygomaxillary fissure, the pterygopalatine fossa, it communicates with the infratemporal fossa through pterygomaxillary fissure, and the infraorbital fissure, it is the pterygopalatine fossa above, it is related to the infraorbital fissure, as well as medial to that communication, it communicates with the infraorbital fissure. That means it communicates with the orbit through the infraorbital fissure, and also medial to that communication we have orbital process of palatine bone and as well as the body of the sphenoid. So 2 fissures came into relation with the pterygopalatine fossa. One is pterygomaxillary fissure and one is infraorbital fissure, or we can call it as inferior orbital fissure also. We can call it as inferior orbital fissure. Okay, and coming to the openings are related to the pterygopalatine fossa. On the posterior wall of the pterygopalatine fossa, so the posterior wall is formed by root of pterygoid process as well as the adjoining part of greater wing of sphenoid. We know that sphenoid has greater wings as well as lesser wings, and body of the sphenoid. Okay, so the posterior wall, it is formed by the root of pterygoid process. This is the pterygoid plate, this is the lateral pterygoid plate, and behind that we have medial pterygoid plate. Now where the pterygoid plates are start, we call it as root of pterygoid process. So posteriorly the pterygopalatine fossa is related to roots of pterygoid process. In the posterior wall we will see 3 openings. So total out of 5 openings, 3 openings are present in the posterior wall. From lateral to medial, what are the openings present in the posterior wall is, one is foramen rotundum. So this is, first one is foramen rotundum. Okay, this is foramen from lateral to medial. First one is foramen rotundum, and next one is pterygoid canal. Next one is pterygoid canal. So this one is the pterygoid canal. The middle one is the anterior opening of pterygoid canal, and the third one is the palatovaginal canal. So these are the 3 openings present in the posterior wall of the pterygopalatine fossa. So what are the openings? Foramen rotundum. So maxillary nerve passes through the foramen rotundum. It comes from the middle cranial fossa to the extracranial part through foramen rotundum. So foramen rotundum, what is the structure passing through the foramen rotundum? Maxillary nerve. Maxillary nerve passes through the foramen rotundum. And coming to the pterygoid, next opening is the pterygoid canal. Pterygoid canal, it allows the pterygoid plexus of nerves and vessels. Pterygoid plexus of nerves and vessels. So what are the structures passing through the anterior opening of pterygoid canal? Means pterygoid plexus of nerves and vessels, they open into the pterygoid canal, anterior opening of the pterygoid canal. And coming to the palatovaginal canal, through pharyngeal vessels and nerves pass through the palatovaginal canal. Pharyngeal nerves and vessels. They pass through the palatovaginal canal. So out of 5 openings, 3 openings situated in the posterior wall. One is from lateral to medial, maxillary, one foramen rotundum for passage of maxillary nerve, pterygoid canal, anterior opening of the pterygoid canal for the passage of pterygoid plexus of nerves and vessels, and the palatovaginal canal, the third opening is the palatovaginal canal for the opening of the pharyngeal nerves and vessels. These are 3 openings. And what are the other 2 openings? The other 2 openings in the pterygopalatine fossa. So other 2 openings are the sphenopalatine foramen on the medial wall. So we know that medially the pterygopalatine fossa, it is related to the perpendicular plate of palatine bone. So in the medial wall, medially we have sphenopalatine foramen is there. Sphenopalatine foramen which allows the sphenopalatine nerves and vessels pass through the sphenopalatine foramen. Okay. So other opening is the sphenopalatine foramen. Out of 3 openings, 3 openings are the foramen rotundum, pterygoid canal and palatovaginal canal. And one more opening is there. One opening is we call sphenopalatine foramen. One opening is there, we call it as sphenopalatine foramen. Sphenopalatine foramen is situated medially to the pterygopalatine fossa. Okay, so sphenopalatine foramen allows the sphenopalatine nerves and vessels. And one more opening is here in the apex. We have one other opening is there, that is called greater palatine canal. So greater palatine canal, it is also present. It is present at the apex, passage of the greater palatine canal, which is present at the apex of the pterygopalatine fossa. So that the 5th opening is the greater palatine canal. Greater palatine canal. Okay, through the greater palatine canal, what are the structures passing through the greater palatine canal means greater palatine nerves and vessels. Greater palatine nerves and vessels, they pass through the greater palatine canal. So in the pterygopalatine fossa, so we have 2 fissures and 5 openings are present. Okay, what are the 2 fissures? They are the pterygomaxillary fissure, where the pterygopalatine fossa communicates with the infratemporal fossa to the pterygomaxillary fissure. Maxillary nerve, maxillary artery passes through the pterygopalatine fissure, and through the inferior orbital fissure. In the pterygopalatine fossa above, it communicates with the inferior orbital fissure. In the inferior orbital fissure, what are the structures passing through the inferior orbital fissure means zygomatic branch of facial nerve passes through the inferior orbital fissure, and orbital branches of the pterygopalatine ganglion also passes through the inferior orbital fissure. So this is the inferior, the 2 fissures, they are related to the pterygopalatine fossa. And what are the openings as related to the pterygopalatine fossa? Totally 5 openings, 3 openings situated in the posterior wall. So from lateral to medial, we have foramen rotatum is there, and pterygoid canal is there, anterior opening of the pterygoid canal for the passage of pterygoid nerves and vessels, and foramen rotatum from maxillary nerve, and below we have palatovascular canal on the most medial aspect, which allows the pharyngeal plexus, pharyngeal arteries and vessels, pharyngeal arteries and nerves. Okay, and one more opening is sphenopalatine foramen situated in the medial wall of the pterygopalatine fossa. So sphenopalatine foramen allows the sphenopalatine nerves and vessels. Okay, another one is the greater palatine canal situated at the apex. Through the greater palatine canal, greater palatine nerves and vessels, they pass through the greater palatine canal. So these are the openings and these are the openings of features related to the pterygopalatine fossa. Okay, and coming to the contents of the pterygopalatine fossa, we have what are the contents of major 3 contents are present in the pterygopalatine fossa. 3 contents are present in the pterygopalatine fossa. One is maxillary nerve. Maxillary nerve. Next one is maxillary artery, and third one is pterygopalatine ganglion. Pterygopalatine ganglion. So one is maxillary nerve, and the next one is maxillary artery, and the third one is pterygopalatine ganglion. These 3 structures, they are the contents of the pterygopalatine fossa. They are the contents of the pterygopalatine fossa. Okay, coming to the maxillary nerve. So the maxillary nerve, it is present in the middle cranial fossa. We know that the skull, it is divided into 3 fossa. Okay, so the skull, it is divided into 3 cranial fossae. This is the anterior cranial fossa, this is middle cranial fossa, and this is the posterior cranial fossa. So the maxillary nerve, it is the situated in the middle cranial fossa. We know that the maxillary nerve, it is the second division of the trigeminal nerve. We know the trigeminal nerve divides into ophthalmic, maxillary and mandibular, right? So the maxillary nerve is the second division of the trigeminal nerve, and it is purely sensory. It arises from the anterior concave border of the trigeminal ganglion, and it is situated in the middle cranial fossa. Maxillary nerve, it is situated in the middle cranial fossa, and it is related, it is present in the lateral wall of the cavernous sinus. This maxillary nerve, it is present in the lateral wall of the cavernous sinus, and above it is also related to trochlear, abducent as well as the oculomotor nerves. These are the nerves related which are present above to the maxillary nerve, and this maxillary nerve, it leaves the middle cranial fossa through the foramen rotundum. So the maxillary nerve, it leaves the cranial fossa through foramen rotundum. We can't see here the foramen rotundum here, but maxillary nerve, it leaves the cranial fossa through foramen rotundum. It enters into the extracranial fossa. This maxillary nerve, now it enters into the pterygopalatine fossa. Okay, so in the first, it lies in the middle cranial fossa. The maxillary nerve, it lies in the middle cranial fossa. It is the second division of the trigeminal nerve, and it is purely sensory nerve, and it arises from the anterior concave border, anterior convex border of the trigeminal ganglion, and it is situated to the lateral wall of the cavernous sinus, and as well as it is related above to the abducent, trochlear and oculomotor nerves. Okay, and this maxillary nerve, it leaves the skull through foramen rotundum, which is situated in the posterior wall, of the pterygopalatine fossa. We know that the posterior wall of the pterygopalatine fossa consists of 3 openings, and first one is the, from lateral one is the foramen rotundum. So it leaves the skull, this maxillary nerve, it leaves the skull through the foramen rotundum. It enters the pterygopalatine fossa. Okay, in the pterygopalatine fossa, it passes in the upper part of the pterygopalatine fossa. It passes in the upper part of the pterygopalatine fossa through a fissure present at the fissure present at the upper part of the posterior part of the body of the maxillary bone, and then it enters into the inferior orbital fissure. Then it enters into the inferior orbital fissure as the infraorbital nerve. So the maxillary nerve, after coming from the foramen rotundum, the maxillary nerve after this is the foramen rotundum. Okay, so the maxillary nerve after coming from the foramen rotundum, it enters into the upper part of the pterygopalatine fossa, and it is situated in the posterior surface of the body of the maxilla. Then it enters into the inferior orbital fissure as the infraorbital nerve. Okay, coming to the branches. What are the branches that are given by the maxillary nerve? So in the middle cranial fossa itself, the middle cranial fossa itself, the maxillary nerve give one branch. Okay, that is called meningeal branch. The maxillary nerve in the middle cranial fossa, it gives one branch. That branch we call it as meningeal branch. Okay, so meningeal branch. So with the name meningeal itself indicates it supplies the meninges of the brain. It supplies the dura mater of the brain. Okay, so the maxillary nerve in the middle cranial fossa, it gives one important branch, that is meningeal branch, which supplies the dura mater of the brain. Okay. And next one is that after entering into the pterygopalatine fossa, the maxillary nerve gives 3 branches. So in the pterygopalatine fossa, the maxillary nerve gives 3 branches. One is ganglionic branches, and the next one is zygomatic branch, and then third one is posterior superior alveolar branch. So these are the 3 branches that are given by the maxillary nerve in the pterygopalatine fossa. We know that pterygopalatine fossa, we can see the pterygopalatine fossa here. See, look here, this is the where I can put the marker. This is the pterygomaxillary fissure here. So this is the pterygomaxillary fissure here, which communicates with the infratemporal fossa with the pterygopalatine fossa. This is the pterygomaxillary fissure here, and deep to the pterygomaxillary fissure, we have pterygopalatine fossa is present. Okay, this is the deep to the pterygomaxillary fissure, we have pterygopalatine fossa is present. Okay. So coming to what are the branches given by the maxillary nerve in the pterygopalatine fossa is ganglionic branches, zygomatic branches, and posterior superior alveolar branches. So coming to the ganglionic branches, that in the pterygopalatine fossa, the pterygopalatine ganglion, it is suspended from the maxillary nerve by 2 roots. Okay, so in the so this is the pterygopalatine fossa, right? This is the pterygopalatine fossa, which is this is the perpendicular plate of palatine bone, which I have mentioned with the stripes. That is the perpendicular plate. This is the pterygopalatine fossa. Okay, so in the pterygopalatine fossa, the maxillary nerve, it suspends the pterygopalatine ganglion by 2 roots. Okay, this is the pterygopalatine ganglion. This is the pterygopalatine ganglion. It is suspended by 2 roots. Okay. So, what are the branches given by the maxillary nerve in the pterygopalatine ganglion? These ganglionic branches, they convey sensory fibers from the orbital periosteum, as well as from the mucous membrane of the pharynx, nose, and palate. So, these ganglionic branches, they convey sensory fibers from the orbital periosteum as well as the mucous membrane of nose, palate, and pharynx. And one more thing is, these ganglionic branches, they also carry postganglionic secretomotor fibers to the lacrimal gland. We know that this pterygopalatine ganglion, it carries post-ganglion, the preganglionic fibers, they relay in the ganglion, and the post-ganglionic secretomotor fibers, they supply the lacrimal gland. So what are the ganglionic branches? These ganglionic branches, they carry sensory fibers from the orbital periosteum as well as the mucous membrane of nose, palate as well as pharynx, and also they carry secretomotor fibers to the post-ganglionic secretomotor fibers to the lacrimal gland. That's about the ganglionic branches. And coming to the zygomatic branches. So see here, this is the zygomatic nerve. Okay, this is the zygomatic nerve. We know that zygomatic nerve, it again divides into two. Okay, this is the zygomaticofacial and this is the zygomaticotemporal. This one is the zygomaticofacial. Zygomaticofacial and this one is the zygomaticotemporal. This zygomaticofacial, it appears in the zygomatic arch. We have a foramen here in the zygomatic. We have a foramen near to the zygomatic bone, that is called zygomaticofacial foramen. The zygomaticofacial nerve, it emerges from the zygomaticoforamen and supplies the skin over the prominence here. That's the zygomaticofacial nerve. So zygomaticofacial nerve, it emerges from the zygomaticofacial foramen, which is situated here, and it supplies the skin over here. And coming to the zygomaticotemporal bone, the zygomaticotemporal bone also, it arises from the zygomaticotemporal foramen and it supplies the skin 2 centimeters above the zygomatic arch and supplies the skin of the temporal region. Okay, so the zygomatic nerve, it divides into two, zygomaticofacial and zygomaticotemporal. The zygomaticofacial nerve, it emerges from the zygomaticofacial nerve and supplies the skin over the prominence, and the zygomaticotemporal nerve, it emerges from the zygomaticoforamen and it supplies the skin of the temporal region 2 centimeters above the zygomatic arch, and also it gives one ascending branch to the lacrimal nerve. So it also gives one ascending branch to the lacrimal nerve. This is which carries post-ganglionic fibers to the lacrimal gland. Okay, so it also gives one ascending branch to the lacrimal. This zygomaticotemporal nerve, it also gives one ascending branch to the lacrimal nerve, which carries the post-ganglionic parasympathetic fibers to the lacrimal gland. Okay, so these are the 3 branches. And one more thing is, third branch is posterior superior alveolar branches. This posterior superior alveolar branches, in the posterior surface of the body of the maxilla, we have 3 to 4 foramina are present. These are nothing but the posterior superior alveolar foramina. The posterior superior alveolar branches, they pass through the posterior superior alveolar foramina and they supply the mucous membrane of the molar tooth and the adjoining gum. And this posterior superior alveolar nerves, they form the superior dental plexus. Okay, the posterior superior alveolar nerve, it passes through the foramina present on the posterior surface of the body of the maxilla, and they supply the mucous membrane of the molar tooth as well as the adjoining gum, and they form the superior dental plexus. It also supplies the mucous membrane of the maxillary sinus. The posterior superior alveolar nerve, it also supplies the mucous membrane of the maxillary sinus as well as it supplies the molar tooth and the adjoining gum, and it forms the superior dental plexus. So these are the 3 branches which are given by the maxillary nerve in the pterygopalatine fossa. What are the 3 branches? Ganglionic branches, zygomatic branch as well as posterior superior alveolar branches. Ganglionic branches, they convey sensory fibers from the nose, palate as well as pharynx, and also from the orbital periosteum. They convey sensory fibers. As well as the ganglionic branches, they convey post-ganglionic parasympathetic secretomotor fibers to the lacrimal gland. Okay, and coming to the zygomatic branch, it divides into zygomaticofacial and zygomaticotemporal. Zygomaticofacial branch, it supplies the skin over the zygomatic bone, and zygomaticotemporal branch, it supplies the skin over the temple region 2 centimeters above the zygomatic arch, and it also gives an ascending branch which passes through the lacrimal nerve and supplies the post-ganglionic secretomotor fibers. And also third branch is the posterior superior alveolar nerve. It passes to 2 to 3 foramina which are present on the posterior surface of the body of the maxilla, and this posterior superior alveolar nerve, it supplies the mucous membrane of the maxillary sinus and its partly placed in the superior dental plexus, and also it supplies the mucous membrane of the molar tooth as well as the adjoining gum. Okay, and coming to the, what are the branches that are given by the maxillary nerve in the infraorbital fissure or inferior orbital fissure. So in the inferior orbital fissure, the maxillary nerve gives two branches. One is anterior superior alveolar nerve and as well as middle superior alveolar nerve. Okay, so coming to the middle superior alveolar nerve, the middle superior, this is the middle superior alveolar nerve. Okay. It passes along the lateral wall of the maxillary sinus and it supplies the adjoining gums of the premolar tooth, adjoining gum and mucous membrane of the premolar tooth. We know that the posterior superior alveolar nerve, it supplies the adjoining gum and mucous membrane of the molar tooth, and the middle superior alveolar, this is the middle superior alveolar nerve. Okay, and the above one we call it as anterior superior alveolar nerve. This is the anterior superior alveolar nerve, middle superior alveolar nerve. Okay, this anterior superior alveolar nerve, middle superior alveolar nerve. Out of the middle superior alveolar nerve, middle, anterior and middle superior alveolar nerve that are given by the maxillary nerve in the inferior orbital fissure. Okay, the middle superior alveolar nerve, it also participates in superior dental plexus along with the posterior superior alveolar nerve and anterior superior alveolar nerve. This middle superior alveolar nerve, it supplies the adjoining gum and mucous membrane of the premolar tooth. And coming to the anterior superior alveolar nerve, it divides into two branches, dental branches and nasal branches. Anterior superior alveolar nerve, it divides into dental branches and nasal branches. The dental branches, they participate in the superior or superior dental plexus, and the nasal branches, they supply the mucous membrane of the nose, mucous membrane of the lateral wall of the nose up to the opening of the maxillary sinus. Mucous membrane of the lateral wall of the nose up to the opening of the maxillary sinus. Okay, and coming to the face, we know that the infraorbital nerve, it comes onto the face through infraorbital foramen. We have in the maxillary. So we have, this is the infraorbital foramen where through the infraorbital nerves and vessels they come out. This is through the infraorbital foramen, the infraorbital nerve comes out and divides into three terminal branches. So these are the three terminal branches that are coming of the maxillary nerve, nothing but the infraorbital nerve. We know that the maxillary nerve continues as the infraorbital nerve, right? So the infraorbital nerve, it comes out through the infraorbital foramen and divides into three terminal branches. What are the three terminal branches means? Nasal, palpebral and superior labial. Nasal, palpebral as well as superior labial. Okay, the palpebral branch, it supplies the skin of the lower eyelid. The nasal branch, it supplies the lateral wall of the nose and the mobile part of the nasal septum. And the superior labial branch, it supplies the upper lip and the mucous membrane regarding the upper lip. Okay, so these are the terminal branches of the infraorbital nerve, which is nothing but the continuation of the maxillary nerve. Okay, so on the face, it gives three terminal branches. Okay, so that's about the maxillary nerve and its branches. So the maxillary nerve, it comes out from the middle cranial fossa. It is the second division of the trigeminal nerve. It is purely sensory nerve and it is situated in the lateral wall of the cavernous sinus in the middle cranial fossa, and above it is related to abduced nerve, trochlear nerve as well as oculomotor nerve, and it leaves the middle cranial fossa through the foramen rotundum. Okay, so this is the foramen rotundum and enters into the upper part of the pterygopalatine fossa and situated in the upper part of the pterygopalatine fossa, and it lies in a fissure formed by the upper part of the posterior surface of the body of the maxilla, and it enters into the infraorbital fissure as the infraorbital nerve. So infraorbital nerve, it is a continuation of the maxillary nerve. So this is the infraorbital nerve, right? So what are the branches given by the maxillary nerve? So the maxillary nerve gives meningeal branch in the middle cranial fossa itself. This is the middle cranial fossa itself, which supplies the dura mater, and in the pterygopalatine fossa, it gives three branches: ganglionic branches, zygomatic branches, and posterior superior alveolar branch. Ganglionic branches, the maxillary nerve, it is the pterygopalatine ganglion. It is suspended by the maxillary nerve by two roots. They carry sensory fibers from the nose palate pharynx as well as from the orbital periosteum, and also they carry postganglionic secretomotor fibers, to the lacrimal gland. Okay, and coming to the zygomatic branch, it divides into two, zygomaticofacial and zygomaticotemporal. Zygomaticofacial supplies the skin over the zygomatic arch here, and zygomaticotemporal supplies the skin over the temporal region 2 centimeters above the zygomatic arch. And it also, zygomaticotemporal nerve, it also gives one ascending branch to the lacrimal nerve. And posterior superior alveolar branches, these posterior superior alveolar branches, they pass to the posterior superior alveolar foramen, which is situated in the posterior surface of the body of the maxilla, and they supply the mucous membrane of the maxillary sinus and the adjoining gum and mucous membrane of the molar tooth, and they participate in superior dental plexus along with the anterior and middle superior alveolar nerves. And coming to on the orbit, what are the branches given by the maxillary nerve in the orbit means anterior superior alveolar branch as well as the middle superior alveolar branch. So the anterior superior alveolar branch, it supplies the mucous membrane and adjoining gum of the canine and incisor teeth. It divides into dental and nasal branches. The dental branches participates in the superior dental plexus, and the nasal branches, they supply the mucous membrane of the lateral wall of the nose up to the opening of the maxillary sinus, and the middle superior alveolar nerve, they also participates in the superior dental plexus. And coming to the terminal branch of the maxillary nerve, it gives 3 terminal branches: palpebral, nasal and superior labial. Palpebral branch, it supplies the lower skin of the lower eyelid, and nasal branch, it supplies the lateral part of the nose under the mobile part of the nasal septum, and superior labial part supplies the skin and mucous membrane of the upper lip. Okay, so that's about the maxillary nerve. And coming to the maxillary artery, we have already discussed the maxillary artery. And what are the branches given by the maxillary artery? Third part of maxillary artery is seen is what are the branches given by the maxillary artery is pig pass. What are the branches given by the third part of maxillary artery is? We know that pig pass is there. So branches given by the maxillary artery is pharyngeal artery, infraorbital artery, greater palatine artery, artery of pterygoid canal, and spinopalatine artery is present here. Artery of pterygoid canal is present here. So these are the 6 branches. They are given by the third part of maxillary artery. Okay. So pharyngeal artery, infraorbital artery, greater palatine artery, artery of pterygoid canal, and spinopalatine artery. These are the branches given by the third part of maxillary artery. So we have discussed them during the infratemporal fossa. We have discussed them, the third part, the branches of the third part of maxillary artery. We have discussed them during the infratemporal fossa. Okay, so that's that's about the contents of the pterygopalatine fossa. So maxillary nerve is over as well as the maxillary artery is over, and coming to the pterygopalatine ganglion. So coming to the contents of the pterygopalatine fossa, we have discussed maxillary nerve and maxillary artery, and the next important content is the pterygopalatine ganglion. So the pterygopalatine ganglion is the largest one when compared to the other 3 preganglionic parasympathetic ganglia. So the pterygopalatine ganglia is the largest parasympathetic ganglia. We know that the submandibular ganglion, and we have discussed about submandibular ganglion, and it is compared the pterygopalatine ganglion. It is largest. It is the largest of the 4 parasympathetic ganglia. Okay. So coming to the pterygopalatine ganglion. Okay. So the preganglionic parasympathetic fibers. The preganglionic parasympathetic fiber, how they relay in the ganglion means, first they pass to the lacrimal nucleus present in the lower pons. The lacrimal nucleus present, the preganglionic fibers, the preganglionic parasympathetic fibers, they come from the lacrimal nucleus present in the lower pons, and they pass through nervous intermediates. From there, they pass through trunk and geniculate ganglion of facial nerve, From there, they pass through trunk and geniculate ganglion of facial nerve. From there, the preganglionic parasympathetic fibers, they pass through greater petrosal nerve, and from there they pass through nerve of pterygoid canal, and finally they relay in the ganglion, finally through the pterygopalatine ganglion. So the preganglionic parasympathetic fibers, they arise from the lacrimatory nucleus. Present in the lower pons. From there, they pass to the nervous intermediates. From the nervous intermediates, they pass through trunk and geniculate ganglion of facial nerve, and from there through greater petrosal nerve, and from there they pass through nerve of pterygoid canal, and then finally they relay in the pterygopalatine ganglion. So we can see geniculate ganglion of facial nerve is present here, and from here through the greater petrosal nerve is present here, and the greater petrosal nerve by the by uniting with the deep petrosal nerve, it forms the nerve of pterygoid canal. From the nerve of pterygoid canal, the preganglionic parasympathetic fibers, they relay here. They relay in the ganglion. They relay in the preganglionic parasympathetic fibers. They relay in the ganglion. Okay, and coming to the postganglionic fibers. The postganglionic fibers, they reach the lacrimal gland, the postganglionic fibers. So the postganglionic parasympathetic fibers, they supply the lacrimal gland, nasal gland, palatine glands as well as pharyngeal glands. So the postganglionic parasympathetic fibers, they reach the lacrimal gland through zygomatic nerve, and through zygomatico-facial nerve, through zygomatico-temporal nerve, and here lacrimal nerve joins with the ascending branch of the zygomatico-temporal nerve, and they supply the lacrimal gland. So through the zygomatic nerve, the postganglionic parasympathetic fibers, they pass to the zygomatic nerve, and then to the zygomatico-temporal nerve. The zygomatico-temporal nerve, it gives one ascending branch. The zygomatico-temporal nerve, it gives one ascending branch which joins with the lacrimal nerve, and through the lacrimal nerve, the fibers, they supply the lacrimal gland. The postganglionic parasympathetic fibers, they supply the lacrimal gland. So we know that how the preganglionic fibers are came and relay in the pterygopalatine ganglion. The postganglionic fibers, they pass through, this is the zygomatic nerve. Okay, this is the zygomatico-temporal nerve. So the zygomatico-temporal nerve and it receives a lacrimal nerve, joins with the ascending branch of the zygomatico-temporal nerve, and it supplies through the lacrimal nerve, the postganglionic parasympathetic fiber, they supply the lacrimal gland. Okay, and the nasal and palatine glands, they receive postganglionic parasympathetic fibers from greater as well as lesser palatine nerves. Okay, and one more thing is, the pterygopalatine ganglion, it is topographically related to the maxillary nerve, but functionally it is related to the facial nerve. We know that because the facial nerve branches, they carry out the preganglionic parasympathetic nerves. So the pterygopalatine ganglion is situated in the pterygopalatine fossa, suspended by the maxillary nerve. It is situated, above it is related to the pterygopalatine ganglion, above it is related to the maxillary nerve, and here in front it is related to the root of pterygoid process, and it is situated between the pharyngeal artery medially and artery of pterygoid canal laterally. Okay, it is one of the largest of the 4 parasympathetic ganglion compared to the otic ganglion, ciliary ganglion and submandibular ganglion. This pterygopalatine ganglion is the largest one. It is the largest parasympathetic ganglion. So the postganglionic fibers, they pass through the maxillary nerve, zygomatico-temporal nerve, and the zygomatico-temporal nerve gives an ascending branch which joins with the lacrimal nerve, and this lacrimal nerve, it supplies the lacrimal gland. The postganglionic parasympathetic fibers, they reach the lacrimal gland through lacrimal nerve. Okay, and coming to the sympathetic branches, we know that the sympathetic fibers, they relay in the superior cervical ganglion, right? All the sympathetic fibers, all the preganglionic sympathetic fibers, they already relay in the superior cervical ganglion, and the postganglionic sympathetic fibers, they pass through the deep petrosal nerve and artery of pterygoid canal, and finally they pass through the ganglion without any interruption, and they are vasomotor. They are vasomotor to the all the palate, mucous membrane of the palate, and nose. They supply the nose, palate as well as the pharynx. Okay, so the post-ganglionic sympathetic fibers, they have relayed in the superior cervical ganglion. They pass through the deep petrosal nerve, artery of pterygoid canal, and pass through the ganglion without any interruption. And the sensory fibers, they are carried out by the maxillary nerve. Okay, so that's about the pterygopalatine ganglion. So the pterygopalatine ganglion, it is situated in the pterygopalatine fossa, suspended by two roots from the maxillary nerve. It is topographically related to the maxillary nerve, but functionally it is related to the facial nerve. And here it is one of the largest ganglion of the four. Compared to the four parasympathetic ganglion, we have four parasympathetic ganglion in the head and neck region: ciliary ganglion, otic ganglion, submandibular ganglion, and pterygopalatine ganglion. Out of all these four, pterygopalatine ganglion is the largest ganglion. It is situated in front of the root of pterygoid canal, and it is situated below the maxillary nerve, and it is present in between the pharyngeal artery medially and artery of pterygoid canal laterally. Okay, it is suspended from the maxillary nerve by two roots. It is suspended by the maxillary nerve by two roots, and the preganglionic parasympathetic fibers, they arise from the lacrimetal nucleus in the lower palms. They pass through nervus intermedius, trunk and geniculate ganglion of facial nerve, and greater petrosal nerve, and from there the nerve of pterygoid canal, and finally the preganglionic parasympathetic fibers, they relay in the pterygopalatine ganglion. Okay, and the postganglionic fibers, here they pass through the postganglionic fibers. Here they pass through zygomatic nerve. Postganglionic fibers, here they pass through zygomatic nerve. They pass through zygomatic nerve, zygomaticotemporal nerve, and they supply the ganglion. Okay, through the lacrimal nerve. So that's about the parasympathetic relay. And coming to the sympathetic relay, we know that the preganglionic sympathetic fibers, they already relay in the superior cervical ganglion. We have three cervical ganglions in the neck region: superior cervical, middle cervical, and inferior cervical. The preganglionic parasympathetic fibers, they relay in the superior cervical ganglion, and the postganglionic fibers, they pass through the petrosal nerve, deep petrosal nerve, by forming plexuses around the internal carotid artery, and from the deep petrosal nerve, the postganglionic sympathetic fibers, they pass through artery of pterygoid canal, and they relay in the ganglion, and they pass through the ganglion without any relay, and they are vasomotor. And coming to the sensory fibers, the sensory fibers are carried out by the maxillary nerve. Okay, so that's about the pterygopalatine ganglion. Coming to the branches from the pterygopalatine ganglion, the pterygopalatine ganglion, it gives four branches: orbital branches, palatine branches, nasal branches, as well as pharyngeal branches. So the distributing branches of the pterygopalatine ganglion are four in number: orbital branches, palatine branches, nasal branches, as well as the pharyngeal branches. Coming to the orbital branches, these pass through the inferior orbital fissure, and they supply the orbital periosteum as well as the mucous membrane of the sphenoidal and ethmoidal air sinuses. This is the orbital branch, right? This is the orbital branch. This one is the orbital branch. Orbital branch, it passes through the inferior orbital fissure along with the infraorbital nerve, and it supplies the orbital periosteum as well as the mucous membrane of the sphenoidal as well as the ethmoidal air sinuses. We know that the paranasal air sinuses are four in number. We have frontal air sinus, maxillary air sinus, sphenoidal air sinus, as well as ethmoidal air sinuses. This orbital branch supplies the mucous membrane of the sphenoidal as well as ethmoidal air sinuses. And coming to the palatine branches, they are greater palatine nerves and lesser palatine nerves are present. This greater palatine nerve, it passes through the greater palatine canal and supplies the mucous membrane of the hard palate. It supplies the mucous membrane of the hard palate, and it passes through the incisive phenomena, and it is in contact with the greater palatine nerve. So the greater palatine nerve, it passes through the it passes through. Coming to the palatine branches, there are greater palatine nerves as well as the lesser palatine nerves. The greater palatine nerves, they pass to the greater palatine canal and they supply the mucous membrane of the hard palate as well as the postero-inferior quadrant as well as the postero-inferior quadrant of the lateral wall of the nose. We know that the lateral wall of the nose, it is divided into 4 quadrants: superomedial, superomedial and superolateral, postero-inferior and postero-superior quadrants. Though the greater palatine, this is the greater palatine nerve. The greater palatine nerve, it supplies the mucous membrane of the hard palate and it supplies the postero-inferior quadrant of the nasal wall of the nose. And coming to the lesser palatine nerves, this is the lesser palatine nerve. The lesser palatine nerves, they pass through the lesser palatine foramina, they pass to the greater palatine canal and they reach the soft palate through lesser palatine foramina and it supplies the mucous membrane of the soft palate, supplies the mucous membrane of the soft palate. So the palatine branches are greater palatine nerve as well as the lesser palatine nerve. The greater palatine nerve, they supplies the mucous membrane of the hard palate. This is the hard palate and this is the soft palate. The greater palatine nerve, it supplies the mucous membrane of the hard palate as well as the postero-inferior quadrant of the nasal cavity. And the lesser palatine nerve, it supplies the mucous membrane of the soft palate. Okay, and coming to the nasal branches are 2 in number. They are posterior medial nasal branch, posterior superior nasal branches, posterior superior medial nasal branches, posterior superior lateral nasal branches. Okay, the nasal branches are 2 in number: posterior superior medial nasal branches, posterior superior lateral nasal branches. Okay, the posterior superior medial nasal branches, they supply the posterior superior quadrant of the medial wall of the nose. They supply the posterior superior quadrant of the medial wall of the nothing but the nasal septum. The posterior superior lateral nasal branches, they supply the posterior superior quadrant of the lateral wall of the nose. Okay. And coming to the pharyngeal branches, the pharyngeal branch, it passes through the palatovaginal canal. We know that in the posterior wall of the pterygopalatine fossa, we have 3 openings are present. Out of this, one of the opening is the palatovaginal canal. So this is the palatovaginal canal. The pharyngeal branch, it passes through the palatovaginal canal and it supplies the mucous membrane of the nasopharynx behind the opening of the auditory. This is the auditory tube opening. Behind the opening of the auditory tube, it supplies the mucous membrane of the nasopharynx. Through totally orbital branches, they passes through the infraorbital foramen. This is the infraorbital region. It passes along with the infraorbital foramen, along with the infraorbital nerve, and they supply the orbital periosteum as well as the mucous membrane of the sphenoid and ethmoidal air sinuses. Palatine branches are greater palatine nerve and as well as lesser palatine nerve. This greater palatine nerve, it supplies, this is the greater palatine nerve, it supplies the mucous membrane of the hard palate, and the lesser palatine nerve, it supplies the mucous membrane of the soft palate. And coming to the nasal branches, there are the posterior superior nasal branches are there, posterior superior lateral nasal branches are there. The posterior superior medial nasal branches, they supply the posterior superior quadrant of the nasal septum, and also one long branch from the posterior superior medial nasal branch is the nasopalatine branch. This long nasopalatine nerve, it passes through the incisive foramen of the hard palate, and the posterior superior lateral nasal branches, they supply the lateral wall of the nose, posterior superior quadrant. And coming to the pharyngeal branch nerve, it passes through the palatovaginal canal and it supplies the mucous membrane of the nasopharynx behind the opening of the auditory tube. So this is the pharynx, right? Nasopharynx, mucous membrane of the pharynx behind the opening of the auditory tube. So that's about the pterygopalatine ganglion.